Good evening, students. This is part 2 of your Exam 1 review for your exam on Wednesday. At the end of the last video, we started talking about the risk factors during prenatal development. Now, we want to pick up with talking about teratogens, which are diseases and environmental hazards. What are teratogens? They are drugs, diseases, or any kind of environmental hazard that cause abnormal development. Examples such as drugs include alcohol, aspirin, caffeine, and nicotine. All of these are detrimental during the very first trimester of pregnancy when all of the major organs are developing, particularly the brain and the nervous system. Nicotine use increases the likelihood of miscarriage, low birth weight, and birth defects. Disease examples such as AIDS, genital herpes, all of these can pass through to the baby during birth, during the vaginal delivery. Rubella, such as German measles, and syphilis can also be passed on to the baby during prenatal development. There are also certain medications that may help treat a woman after she becomes ill, but they do not prevent damage to the fetus. Teratogens also include environmental hazards such as air pollution, lead, PCBs, X-rays, and exposing the fetus to these hazards can affect both physical and mental development of the fetus before birth and of the child after birth. It can also lead to the child's developing health issues such as leukemias after birth. Many of these genetic defects do not show up immediately after birth. For the reflexes, they are unborn, unlearned responses in the newborn that are triggered by specific stimuli, such as eye blinking. And eye blinking, we know, has a survival value. How to assess the newborn? There are 5 APGAR scores, which is a scoring system to assess how healthy the newborn is immediately following birth. They assess breathing, heartbeat, muscle tone, and reflexes, as well as the skin tone. And each of these items are scored on a scale from 0 to 2. Then they are given a sum total, which is taken to assess the newborn. Thus, as you see, if they have a total of 7 or more, they are in good physical condition. And if they have a total of 4 to 6, that means the baby needs some special attention, may have to be placed in newborn intensive care unit. If they have a total of 3 or less, then this is life-threatening, and more than likely the baby will not survive. We all know about sudden infant death syndrome, which is an unexplainable death of a healthy baby, and yet it is called the acronym SIDS. And there are certain risk factors about SIDS to indicate that. If the baby is premature birth, low birth weight, and if there's parental smoking around the baby, which we know is very hazardous anyway, if the child overheats and the baby sleeps on their stomach. And one of the real high risk factors, African Americans and Native American infants often sleep on their stomachs rather than on their backs. So now the trend is the safest way for the baby to sleep is on their backs. How does the body grow and develop? Well, even during prenatal development, the infant's head, which is in the caudal region, and top part of the body develops before the rest of the body. And the proximal distal principle is a sequence of physical maturation and growth that proceeds from the center of the body, which is called the proximal region, to the extremities, the distal region. Emerging nervous system. The nerve cell are commonly known as the neuron. We know that the neuron of the nerve cell does not reproduce itself. Babies are born with many dendrites. Root-like structures, they attach to the cell body of a neuron. This is a neuron that receives impulses from other neurons. Then you have the axon terminal, which is at the end of the synaptic bulbs, these little root-like structures here. Don't get confused with the dendrites. As we know, the dendrites receive impulses, but the axons is a long, thin part, the little purple part here, which transmits impulses to other neurons or nerve cells, or an organ or muscle from branching structures called terminal buttons. So they send impulses to the dendrites, to other nerve cells throughout the body. Then you have the nucleus. We know is the center of the cell. This is where all your DNA material and chromosomes are located, your communication system of the body. Then you have the myelin sheath. The myelin sheath is a spatty insulation or layer that surrounds this long, thin axon, and it is the central nervous system is made of glial cells. It mainly protects the axon. Then the cell body is this green section that surrounds the nucleus, and it helps keep the nerve cell alive and help it fires. This is the nerve cell. You will have to identify the function and the structures on your exam. The diagram is not there, but you do need to know the functions and the name of the structures. Now, we also talked about the brain. The nerve cells are located in the brain, and you know that there are 1, 2, 3, 4, actually 5 lobes of the brain. The cerebellum, which is a part of the hindbrain involved in muscle coordination and movement of the body. The structure right here, okay? Then you have the cerebrum, which is this whole large mass, all these different colors. It's the cerebrum, which is the largest lobe of the brain. And it consists of 2 hemispheres, which is responsible for your thinking, language, your thought processes, okay? And also help control your emotions. The frontal lobe of the cerebral cortex is in front of the cerebrum, and this also help control your memory and thought processes. And this is the prefrontal lobe, which is the center of thinking and language, highly active during visual and spatial problem solving. Your sense of yourself, being in and operating on the world, may reside in the prefrontal cortex, which is the prefrontal lobe. Then the pons, which is the structure of the hindbrain, which is involved in regulation of movement and as well as sleep arousal and helps you to breathe. Then you have the medulla, which is involved in regulation of your heart rate, your blood pressure, respiration. This is your medulla. Then, of course, your occipital lobe, which is the lobe that lies behind and below the parietal lobe, behind the temporal lobe. When light strikes the eyes, the neurons in the lobe, they fire, and as a result, we see. That's why it is so important that head trauma, you do not fall on the back of your head. If you fall on the front of your head, severe head trauma can damage your memory, thought processes. So be sure you know the structures of the brain and the nerve system. Motor development, there is a theory called dynamic systems theory. Instead of a simple maturation, motor development involves distinct skills that are organized in and reorganized over time to meet specific tasks, such as walking, running, and jumping. And by 7 months, infants can usually sit alone, and by 14 months, toddlers can usually stand alone briefly, and they can walk without assistance. Balance and stepping has a lot to do with how well the toddler can balance at 14 months. Infants are capable of stepping, which is moving the leg alternately, long before they can even walk. So to walk, you got to step. The ability to maintain an upright posture is fundamental to walking. but upright posture is literally impossible for newborns and young infants because they are really top heavy because of that cephalocaudal principle. Coordinating skills. Here you see, we know that walking skills must be learned separately and integrated with the other skills. Integration is the combining the components into a sequence needed to accomplish the task. So there is a process of learning to walk, and when all of these skills are integrated, then the toddler learns to walk. Differentiation, mastery of these component skills. Once they master all of these skills integrated together, then they have mastered them and learned to walk. And then things that are unsupported, such as independent walking, occurs at about 12 to 15 months once children have mastered coordinated skills. This is not proven because not all infants or toddlers walk and integrate these skills at the same rate of speed. Motor skills, as we have defined, includes these gross motor skills and these fine motor skills. Walking, running, and jumping is a gross motor skill that uses the large muscles of the body. They usually develop these large gross motor skills before they do the fine motor skills. Grasping, holding manipulated objects, reaching, all of these are fine motor skills. Learning to hold a cup, pencil, or utensil requires mastery. Finally, we want to talk about autism, which we know very little about scientifically. Many studies have been done, and neuroscientists have decided that it is a serious neurocognitive disorder that begins early in life, as early as 2 years of age. And if these children are diagnosed early, given early treatment, then they have better chance of being able to function. What are symptoms of autism? They acquire language development later than other children, later than usual. Their speech often echoes what others say to them. They imitate what you say or mimic what they hear. They become more interested in objects over other people, and they have very poor social skills. What are some causes of autism? Well, it can be genetic. If the child is born prematurely or to older mothers, being exposed prenatally to toxins, atypical brain functioning due to imbalanced excitatory and inhibitory neurotransmitters. These are those substances in the brain that either they are not functioning correctly, they're not being transmitted properly to other parts of the brain to keep them in balance, which causes the imbalance in the brain. Certain medications can be used to reduce the compulsive behaviors and the depression. They often become obsessed, and they're very compulsive, doing the same behaviors over and over. But there's no real cure, but they can use therapy to help improve the social and the verbal skills. There's often a behavioral component to autism. And this is not all, but these are just some basic things that I will be looking for you to discuss in your question on autism. So this is the end of the material for exam 1. Make sure you review all of the concepts that have been discussed, your handouts, PowerPoints, textbook readings as well. Good luck on your exam.